Hey everyone, Haley Arnold here, and today I'm going to be demonstrating male and female catheter care via the Kentucky Medicaid Nurse Aid Handbook, aka the Bible. So first things first, I'm just going to show you the equipment we'll be needing, and actually we're going to be using our imagination very heavily here. We're not in a traditional hospital setting or a teaching setting, so we're just going to kind of go with the flow. So here we go. Today we'll be needing a bed cover, pair of gloves, some soap, a couple of washcloths, a wash basin, and a bed towel. Alrighty. So let's just jump right into it. Before anything, we're going to knock on the patient's door. Check the patient's wristband. Hello, Miss Jones. My name's Haley, and today we're going to be cleaning your catheter for you. Going to do my hand hygiene and then provide privacy for the patient. And then at this point, this is when I would go ahead and get my water ready in my wash basin. And then before we get started with anything, before we start prepping the patient, I need to raise the bed to a comfortable level to me. So I'm going to raise the bed rails on both sides of the bed, walk over to the other side of the bed, put the side rails up, raise the bed so I'm not tippy-toeing or leaning too far over. And then since I'm going to be working on this side of the body first, I'm going to be putting the side rails down on this side. And now we're ready to go ahead and start prepping to access the peri area. So first things first, we're going to go ahead and we're going to take our bath towel. And what we're going to do is we're not going to start unfolding it away from the bed. We're going to place it on top of the patient and start unfolding it, because we don't want to have the opportunity to let it drag onto the floor to be contaminated. Then we don't want to fling it out like we would a sheet at home, because we would just fling microbes everywhere. Alright, so now that we have the bath towel on the patient, the next thing that we're going to do is we're just going to go ahead and start folding down the sheet that was previously on top of the patient. And we don't have to take it all the way to the feet. We can just take it a little bit below the peri area. So make it a little bit easier for us later. Next thing that we're going to do is we're going to grab our bed cover and again place it on top of the patient. Go ahead and unfold here. Now before we touch the patient or anything, I'm going to go ahead and put my gloves on at this point. Alright, so now we got our gloves on. Now what I'm going to do is I'm going to move the bed cover over to the side for a second, and I'm going to go ahead and expose the peri area. Now again, we're not in a traditional setting, so I don't have a proper mannequin to use, so we're just going to pretend that this is Mrs. Jones. So we do have a female mannequin over here. We're going to pretend this is about the vaginal region. So what I'm going to do is I'm going to actually semi-fold the bed cover right here underneath the area that we'll be cleaning today, which is the genital area. I'm going to take Mrs. Jones by the hip. I'm going to slowly roll her over, tuck the bed cover underneath her, and then let her roll back down gently. Now we're ready to start cleaning. Now again, this is catheter care, so in the vagina there would be a catheter coming out of that area. So I'm going to take my washcloths. I'm going to have two separate washcloths. The first one I'm going to have is an actual washing washcloth, and then I'm going to have a rinse washcloth. So for our washing washcloth, what we want to do is we're going to go ahead and wet it in our wash basin. We got our soap here. We're just going to dab, dab, dab a little bit. Now, instead of making a mitt like we would when we're doing bed baths, we're going to be taking our washcloth like this with our fingers, since we're going to be in a very intricate part of the body. So what I'm going to do is, again, this is a female mannequin. I'm going to separate the labias, and this is going to expose the meatus. Now the meatus is where the opening of the urethra is, and this is where the catheter is going to run. So I'm going to take my washcloth and I'm going to wash around the meatus. And I'm going to, as I'm washing, just look for any abnormalities, any secretions, any crust, anything like that. And I will wash the area until clean. And then I'm going to move to another part of the washcloth, and I'm going to just wash down the catheter about 4 inches. Again, with every pass, I'm going to change the area of the washcloth. Now I'm ready to use a rinse rag. So what I'm going to do is I'm going to use the same finger technique. I'm going to, again, spread the labias apart to expose the meatus. Going to rinse around the meatus a couple of times. Again, with every pass, I'm going to move to a different part of the rinse rag. And now I'm going to rinse the catheter. And I'm going to rinse down the catheter a few times. And every time I do that, I'm going to go to a different area of the rag. Now at this point, I just want to explain a couple of points if we had a male patient. Now, of course, we would have a penis with a catheter and an uncircumcised penis. Actually, you would have to take the foreskin and move the foreskin and pull it backwards to expose the meatus, and then you would start cleaning and washing until clean. And you would just have to basically just look for any secretions, any crust, same thing as you would for a female. And just remember to wipe down the catheter 3 to 4 inches as well. Alrighty. Now that we have everything clean, next thing I'm going to do is I'm going to take the patient, move her back over by the hips. I'm going to take the bed cover and start rolling it away from me. Gently set her back down. I'm going to take this, I'm going to toss it. Now I'm ready to toss my gloves as well. I'm going to go ahead, put the bath towel back over the patient, and then start taking the first initial sheet that was covering the patient and pull it back up to make her nice and covered again. Now I'm going to start taking the top bath towel and folding it away from me and the patient. I'm going to toss this over to the side and it's hampered. And now I have the side rails down on this side, however up on the other side. So I'm going to raise the side rails up on this side. I'm going to move the bed back down to its original position. Side rails down on this side. Walk over to the other side of the bed. Side rails down on that side. And then I'm going to get my call light, place my call light within perfect reach of the patient. And then as always, you want to make sure you report and record. Thank you.